I feel quite proud actually of how the UK are handling the rollout of CAR T cells. I think it was one of the first socialised healthcare systems to approve and start rolling out CAR T cells. It's happening very quickly, which in one sense is great because we have patients who need it. The demand is there. But on the other hand, it's really there are problems with that and challenges. And one challenge, for example, is do we have simply the patient information, written patient information, written in lay language that's been through patient representatives to check it makes sense. Have we got that in place? I'm not sure we always do. So simple things like that, we may be running slightly ahead of ourselves, but as I say, that's potentially good though that our patients are getting access. So great that that's happening. I like the way as well that NHS England are doing a phased rollout. So in my institution, for example, we're not a CAR T cell centre yet. I don't think I would really expect to be. But there is a second wave now that we've sort of held up our hand to apply for that. We may or may not be a second wave. But I think NHS England are being very realistic that if this therapy does deliver on the promises, so it may become available in a number of different indications, we're going to eventually almost certainly have quite a few centres in the UK, but it's making sure it happens safely, making sure the quality assurance is in place, making sure there's training, expertise. But I think one key thing going forward, and I'm not yet convinced this is happening, is that we pool our experience in the UK so that the first wave of centres are sharing their experiences together, but also with the second wave as they open, making sure we've got the right protocols to manage complications, but also how do we make sure the patients are going to the right centres in a timely way within a UK context. So there's still things to learn, I think, but it is very exciting.